Very good morning to respected one and all. I am going to talk about the interplay of antihypertensive medications, ocular perfusion pressure, and glaucoma progression. There are no financial interests or relations to disclose as a part of this study. And coming to introduction, we all know glaucoma is a chronic progressive optic neuropathy characterized by RGC death and associated visual loss. Among different vascular factors associated with glaucoma, blood pressure is the most studied factor because it is related to both microvascular blood flow and also to the IOP, because these two main elements determine the ocular perfusion pressure. And there is a bimodal relationship which was established recently between blood pressure and the risk of glaucoma, indicating that either the patients with her having either high BP or low BP have risk of developing or progressing of glaucoma, because in the patients with systemic hypertension and glaucoma, vascular dysfunction does not allow the activation of autoregulatory mechanisms. So this will lead to decrease in IOP even though there is increase or decrease in blood pressure. Several markers may be used to assess the risk of glaucoma. Among that, we have studied about the ocular perfusion pressure, which is a potential marker of ONH perfusion and major culprit in causing and progressing glaucoma. The aim of the study is to evaluate the relationship between the antihypertensive medication and the progress of glaucoma. And my objectives are I will assess the effect of antihypertensive medication at bedtime on systolic, diastolic, and ocular perfusion pressures, and these pressures associated with the progression of glaucoma. And this is a type of analytical observational study done for 6 months in the tertiary case center in Andhra Pradesh. There is a specific inclusion criteria for this study. I have taken the patients who are a known case of primary open angle glaucoma associated with primary systemic hypertension, and they are using both the anti-glaucoma medications and antihypertensive medication at bedtime for at least 1 year. And all these patients were assessed by single observer, and these patients were we have took 45 glaucoma patients. When these patients were divided into 3 groups based on ICD-10 guidelines into early, moderate, and advanced glaucoma. And we have excluded the patients who are not on bedtime antihypertensive medication, and the patients who are not on regular anti-glaucoma therapy, and the patients who already underwent surgical glaucoma management, and the secondary glaucomas and secondary hypertensions are excluded from this study. And we have done assessment of best corrected visual acuity, anterior segment examination, then followed by IOP by Goldman applanation tonometry. We have done 24-dash Humphrey visual fields for every patient, and 4-mirror indirect contact gonioscopy was done. And after that, we have done dilated fundus examination. And after 5-minute period of rest, we have measured supine position blood pressure, which we took 2 recordings and make an average of that, and we calculated mean ocular perfusion pressure using the formula, which is 2/3 of mean arterial pressure less than intraocular pressure. So mean arterial pressure is diastolic blood pressure plus 1/3 of pulse pressure, and systolic perfusion pressure and diastolic perfusion pressure are calculated by the formulas. And we have obtained the significance by using ANOVA single factor test. In all those statistically tests, we took the p-value which is less than 0.05 to be significant. And as the patients are medically controlled IOP, there is no significant mean difference between the 3 glaucoma groups in IOP, but whereas ocular perfusion pressure in advanced glaucoma is around 50 mmHg, and whereas in early glaucoma it is around 60 mmHg, and there is statistically significant difference among these 3 groups. And similarly with that of diastolic perfusion pressure, there is significant statistically significant difference among these 3 groups. Similar to that of systolic perfusion pressure also, there is a mean difference which is statistically significant among the early, moderate, and advanced glaucoma groups. And coming to discussion, the study ascertains the patients who are on rigorous antihypertensive treatment are due to nocturnal hypotension. These patients have low perfusion pressures and they are increased at progression of glaucoma. There are some other studies which have showed the similar relation, and there are 2 studies which were done by Kim et al. And Rekha Kandalwal et al. Inferred that lower mean ocular perfusion pressure was shown in the patients with open angle glaucoma when compared with controls, and the Baltimore Eye study showed a stronger association between diastolic perfusion pressure less than 50 mmHg with the development of glaucoma. And similarly, the Singapore Malay Eye study also reported the low diastolic perfusion and low diastolic blood pressure and low mean ocular perfusion pressure are the independent risk factors for open angle glaucoma. And there are other similar studies which shows the open angle glaucoma risk with diastolic perfusion pressure less than 50 mmHg. Similarly, Los Angeles Latino study was showing increased prevalence of open angle glaucoma with lower mean ocular pressure. And from these studies, it is understood that people that on antihypertensive medication have increased risk of developing progressing of glaucoma. And the main limitations of the study are the blood pressure and IOP measurements were performed only once during daytime, and there is no 24-hour blood pressure monitoring and no 24-hour IOP recording. So this was the main limitation of the study, and the single IOP measurement can miss the IOP peak and IOP fluctuations, and direct measurement of ocular blood flow by velocimetry and speckle flow flowmetry and all these things have more usual assessment of and more accurately assessing the ocular blood flow when compared to that of we are using only a theoretical formula by calculating the blood pressure, intraocular pressure. Maybe direct methods of knowing the perfusion pressure ocular blood flow was more valuable in this case studies, and my study concluded that lower blood pressure, lower perfusion pressure are having more higher risk of progression of glaucoma. So perfusion pressures can be potential screening tools to identify the patients on overdosage, and we can decrease the rigorous antihypertensive treatment to avoid night dosage in patients with nocturnal dippings. These are my references. Thank you.
So to increase the perfusion pressure, what can be done? One is decrease intraocular pressure, and second is increase blood pressure. So you should stop antihypertensive treatment in these patients?
No, sir. But we can avoid nighttime. But we can avoid nighttime antihypertensive therapy in these patients. So we can prevent the nocturnal dipping of blood pressure. So prevent systemic hypotension. So we will decrease the.
So did you evaluate any specific type of antihypertensive treatment which cause less of postural and nocturnal hypotension?
No, sir. These patients are generally, usually these patients are all using clinidipine and amlodipine. So these patients are using calcium channel blockers mainly. So I haven't compared any among different types of
there's difference between this hypotension between calcium channel blockers and the beta blockers. So you could have evaluated that, right?
Thank you very much.